It is time for your health check. You know, 1 in 8 women will get breast cancer in her lifetime. For an average risk woman, the recommendation is to start yearly mammograms at age 40. Now, high-risk women, you may qualify for screening earlier than 40 if you have a family history, particularly a parent, sibling, or child who's had breast cancer, or if you have a known genetic mutation for developing it. So I have an aunt who died from breast cancer when she was just 53, so she was diagnosed pre-menopause. So I made an appointment at Baylor Scott & White, and here's how it went.
Again, I'm Shaquita. I'll be completing the registration.
The older you get, these milestone ages bring on new adventures. For women turning 40, the big one is a yearly mammogram.
This is my second one.
Okay.
Why 40? Well, studies show 1/6 of all breast cancers in women happen below age 50.
You're in the developmental stages of breast cancer below 40, oftentimes, or below 50, and you don't even know it.
That's right, yeah. Cancer is a slow process usually, and the reason we do screening mammography is to be able to find cancers when they're the smallest and most treatable.
At Baylor, every woman who comes in for a screening mammogram gets a risk assessment at no cost.
You will know your risk score. You will know your likelihood for developing breast cancer.
So here we are, ready to show you what a 3D mammogram looks like.
Try to just relax that shoulder.
Courtney sets me up and takes 4 pictures at different angles, guiding me through when to breathe and when not to.
Good. And now stop your breathing, please.
You feel a little pressure, but the whole thing is over in minutes. Then the results.
All right, so
Typically, there's a waiting period, but for the purposes of our story, Dr. Sean Raj, medical director of Baylor's high-risk breast program, offered me immediate feedback.
I don't see anything concerning on these initial pictures.
Dr. Raj pulled up my screening images from 2017 for comparison. Because of my family history, I decided then to start screening earlier than guidelines suggest.
This is an area that I want to look at a little bit more carefully. We'll have you take one more picture here and go from there and see what it shows.
Dr. Raj had Courtney take more images in order to look more closely at some subtle changes he noticed between 2017 and
There we
now.
go. I'm going to get right underneath you. We're going to go forward just a little bit.
After examining the layers of dense breast tissue, he gave me the all clear.
There you go. You got a clean bill of breast health. Congratulations.
That's what we're going for here.
Yes, ma'am.
Okay.
All right, and some myths about breast cancer this morning, that it's painful. Well, Dr. Raj says pain is usually actually not associated with breast cancer. So if you're feeling pain, he says that's likely either hormonal or the result of a poor fitting bra, frankly. Myth number 2, that women with smaller breasts can't be diagnosed with breast cancer. That is also false. Breast cancer, of course, as we know, does not discriminate. And number 3, that men can't get breast cancer. That is big time false. While men don't need screening mammograms at 40, they in fact can get breast cancer. So for men and women, if you notice any changes, a lump, a rash, discoloration, focal pain, or bleeding, definitely talk to your doctor for further examination. By the way, we've linked my colleague Jason Wheeler's story about self-breast exams for men to this story on WFAA.com. My thanks to Tiffany Liu for helping me out with that story. All right.